Live from the Scripps Studios, this is 10 News.
County leaders say we are flattening the curve, but there is still work to be done. Good evening, I'm Kimberly Hunt. To date, the county has reported 1,930 cases. 83 of those are new from yesterday. The county also announced 6 more people have died, bringing the region's death toll to 53. There is good news, as more than 680 people have recovered from coronavirus locally. Nationally, more than 45,000 people have recovered. San Diego leaders are trying to get more people off the streets during the coronavirus outbreak. The convention center is now acting as a shelter, and it's far from full. Today, the mayor outlined how the city plans to fill those beds and keep people healthy. 10 News anchor Lindsay Pena shows us how the homeless population is responding to the outreach.
The process of moving hundreds of people from San Diego's bridge shelters to the convention center wrapped up last week. Now begins the process of trying to get people off the streets.
Our goal is to get 1,500 folks being helped to be not only sheltered at the convention center, but all of the work that's helping to get them back on their feet and into that permanent supportive housing of their own.
During today's coronavirus update, Mayor Kevin Faulconer outlined phase 2 of the city's plan for the homeless population during the pandemic.
Encouraging people to come inside. It's not safe, it's unsanitary to be living out in some of the conditions out on the streets. We have a better choice and a better solution to you.
The city is partnering with organizations like Alpha Project to reach out to people everywhere. Those seeing it firsthand say even those who'd been resistant to help are accepting it now.
Well, all those resources are dried up, and so people are kind of panicking because they don't have any sustenance. They don't have access to food and things like that.
And even though it's taking longer than usual, there's still plenty of beds.
Now, because we have to go through the screening process, it's taking a lot more time. And, we don't want to, obviously, we have a commitment to the 400 people we have inside now to try and keep them safe and healthy.
Lindsay Pena, 10 News.
California will look at 6 factors to determine when the stay-at-home order will loosen. But Governor Newsom says even when that order is lifted, society won't snap back to normal.
We talk about what the new normal will look like. As I said, normal it will not be, at least until we had herd immunity and we have a vaccine. Because as someone like yourself that looks forward to going back out and having dinner, as the doctor said, you may be having dinner with a waiter wearing gloves, maybe a face mask, dinner where the menu is disposable, where the tables, half of the tables in that restaurant no longer appear, where your temperature is checked before you walk in to the establishment.
With the new parameters Newsom outlined today suggest the state must meet a high bar before walking back the order. His administration highlighted 6 key indicators, and they include the ability to closely monitor and track potential cases, prevent infection of high-risk people, prepare hospitals to handle surges, develop therapeutics to meet demand, ensure businesses, schools, and child care facilities can support social distancing, and develop guidelines for when to ask Californians to stay home again if necessary. California has more than 25,000 confirmed cases of COVID-19 and 767 deaths. County leaders have been working with Governor Newsom on the plans for the eventual easing of these restrictions. But when that happens and we return to work and school will be gradual with significant changes to the normal routine.
The reality is our way of life will be different for a while. We will come back. We will get through this. We will make progress. We will rebuild. But it is really important that we do it in the right way and that we do it in the proper way. And that's not only important for the life and health of our residents, it is important for the life and health of our economy to have a sustained rebuild and a sustained pathway out of this. So we will continue our coordination with the state of California along with our internal efforts in these 6 core key areas.
Well, county leaders also spotlighted the San Diego Workforce Partnership. They offer resources to help people find work. And they say right now they're helping companies such as Qualcomm and Home Depot fill more than 300 open positions. President Trump is now acknowledging he will work with governors to get the nation back into business. My co-anchor Steve Atkinson is joining us now from his home with a look at that plan. Steve?
Kim, this pandemic has killed more than 25,000 Americans, infected more than 600,000. And while there does appear to be a flattening of the curve in some of the hardest hit states, here's what the governors fear. They fear that reopening their communities too soon will only cause another severe outbreak. Here's ABC's Romina Puga.
Tuesday, President Trump saying he'd like to reopen parts of the economy by May 1st or sooner.
We will soon be sharing details and new guidelines with everybody. I will be speaking to all 50 governors very shortly.
Governors on both coasts already working together to plan an eventual reopening. But before that can happen, officials say we need widespread testing.
The FDA has now authorized the first test developed by researchers from Rutgers University that can use saliva from patients. It's the first one.
Others worrying that opening the country for business too soon could prove dire.
Everyone's concerned that we get over the apex of the curve. They're worried about a spike again downstream.
If we do something stupid, you will see those numbers go right back up tomorrow.
This week, it's becoming clear that nursing homes are the epicenters of this crisis. 25% of COVID-19 deaths in New York State were in adult care facilities and nursing homes. 45% of deaths in Massachusetts were in these homes, and a staggering 50% in Philadelphia. As the virus continues to sweep the country, Louisiana reported its deadliest day yet.
Every one of these numbers is a person. It's one of our neighbors. It's one of our friends. It's somebody's parent, somebody's child.
South Dakota, now home to one of the largest clusters in the U.S., nearly 450 workers at a pork processing plant in Sioux Falls are sick, and more than 100 people who came in contact with them now testing positive.
And the FDA now fast-tracking an experimental plasma treatment, allowing patients who have had the virus and recovered to donate the plasma component of their blood, which may have antibodies which fight the virus. In Los Angeles, Romina Puga, ABC News.
President Trump also announced today he is ordering the U.S. to halt payments to the World Health Organization. He claims the organization severely mismanaged and covered up the spread of the coronavirus.
The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts. There was credible information to suspect human-to-human transmission in December 2019, which should have spurred the WHO to investigate and investigate immediately. Through the middle of January, it parroted and publicly endorsed the idea that there was not human-to-human transmission happening despite reports and clear evidence to the contrary. The delays the WHO experienced in declaring a public health emergency cost valuable time.
And just for reference, the United States did contribute $553 million to the World Health Organization last year. Kim?
All right. Thank you, Steve. And 4 more MTS bus drivers and 2 trolley maintenance workers have tested positive. This is in addition to the first case reported last week. Ridership has plummeted by about 65% during the pandemic. Many bus routes have been reduced to prevent the spread. And MTS also started a rear door boarding policy and suspended cash payments. We're finding out more about how San Diego Unified students will be graded for their work while distance learning. Today, the Board of Education approved grade protection. That means no student will be given a final academic grade lower than the grade they had before this distance learning began. Virtual learning began on April 6th, and grading is not scheduled to begin until April 27th. Well, a San Diego-based nurse on the front lines in New York City's hospital gets saluted for her work saving lives. She tells 10 News anchor Vanessa Van Hefty it's been a life-changing experience.
Anna Wilkinson has served as a nurse on medical missions all around the world. When the call for more nurses came from New York City, she packed her bags. Her firefighter husband and sons understood.
He has the kids, go ahead, I got you.
She's been in New York City for a week and a half, working 12-hour overnight shifts for 7 days straight.
I think the hardest thing for me is, having them not see their loved ones before they die.
So she's there, holding their hands and doing what medicine cannot.
I do my little dance, and they love it.
The ER nurse says she's had profound experiences being there when no one else can.
I even did it with one gentleman. I said, tell me your fondest memory. And he was telling me riding my bike, my dad teaching me how to ride my bike. I was just trying to get the positive out of him. And he died. So, it's just, it's real. It's not, it's real. And that was very difficult. That was a life-changing event for me.
She finds comfort in letters from her sons home in San Diego, telling her to stay safe. And from these moments when New York City firefighters surround the hospital to applaud the doctors and nurses on the front line.
I was just at awe with them. We don't hear it much often, us nurses. We don't. So it was just so lovely.
But she's not here for the applause or the pay. She's here for one reason.
And my motto is nobody dies alone. 100% honored to be here with New York City. 100% honored.
Vanessa Van Hefty, 10 News.
And Anna says she has a few weeks left of work, but she is considering extending her time there due to the need. How incredible.